Hey, Energy Physio on episode 3 of the Ultimate Guide to Sports Med. In the last video, we went through the workflow of injury to back to your normal, and we kind of saw some flaws in that, started to fill in some gaps on maybe what's missing from our train of thought on how we return to sport after an injury. One of those being how we deal with pain after an injury and what that should look like. And so in the workflow, it recommends your home treatment being the RICE method, which is rest, ice, compression, elevation. And about 2 years ago, Dr. Gabe Mirkin, who created the RICE method, actually withdrew his own method because what we're starting to see is evidence stacking up against some of these common wisdoms and conventional treatments that we've been doing kind of broad spectrum and widespread. And so particularly dealing with rest is that we know total rest and taking all load out of a tissue actually is worse for its healing response. And so we not only are we dealing with disuse atrophy in the area, but we have scar tissue that doesn't align very well. We have tissues that don't respond to loading as well once it's appropriate to start loading them in a way to restore capacity. And so what we have found is that actually something I call logical loading, which is a loading that doesn't go beyond what the tissue can handle. It doesn't create pain, it doesn't create more damage, but actually moves the limb in a way that creates stress in the tissue to help it heal correctly. We're finding that this is really beneficial for healing tissues to help realign the scar tissue in a way that's correct, and actually once this tissue is done healing, looks a lot more like normal tissue than when we don't load the tissue at all. The next one is ice, and so when you ice, you also have to do total rest, and so there's a double whammy there. But what we're seeing now is that anything that decreases inflammation is going to slow our healing response down. And we've got good research on this, particularly around bone healing and the use of non-steroidal anti-inflammatories. So it turns out that bones heal the same way. They have the same inflammatory response and cascade of events as a bruise or a cut on your skin. So really this is kind of covers the spectrum of injury and how the body heals, in that if we reduce inflammation, then we're potentially going to drag out our healing times, and our inflammatory response is going to take much longer. So the body's pretty smart. It's going to send what it needs to an injured area. It's going to send exactly what it needs, and if we slow that process down, the process is still going to happen completely, just going to take a longer amount of time. The other big thing around ice is that the research really sucks. They all come to the conclusion that we need more research, but they never really get down to the nitty-gritty about, how cold, how long, and how deep does it go. So there's research showing superficial nerve injury with the use of icing injuries, and that's because it doesn't address how cold, how deep, for how long. But let's think about just the difference in people. Some people might have more fatty tissue around an injured area, or a large amount of muscle mass around an injured area, or somebody might be really lean and very thin. And so in these different scenarios, how deep, how cold, for how long, there's just a lot of unknown variables around icing that don't fit into this evidence-based medicine model, but we see ice being applied in home and in clinic all over the world. So not enough research here to convince me that we should be doing it, and evidence is actually stacking up now that we shouldn't. And then a small case for compression is that, yes, we know creating a pressure gradient in a limb can help move fluid out of the limb, but it doesn't put it in the lymphatic system, which is what clears it. And also, by the nature of creating a gradient to push something out, that gradient is also limiting stuff from coming in. So yes, you may be pushing fluid up through the leg or up through the arm, but you're also limiting blood flow and oxygen from effectively getting in because it's having to go against the gradient. So these are all passive things. Rest is passive, ice is passive, compression is passive. Elevation really isn't too bad, but it's still passive. And so it goes against this idea that we should be doing a more active recovery. A logical loading, which does a couple of things. It helps realign scar tissue. It helps reinforce blood flow into the area and this cascade of events to help heal the tissue. It also creates an internal compression within the muscle that drives the lymphatic system. So the lymphatic system, we know, only functions via muscle activation and large vessel pulsation, none of which you get with total rest. And so, but by logical loading, you can create an internal compression that activates the lymphatic system, clears the fluid, also brings in blood flow and oxygen, which is good. And so really an active recovery does all these things in a much smarter way besides just sitting on your rear, resting with an ice bag on, maybe with some added compression. The other thing to address about pain specifically, and especially going back to the idea that once your pain is gone, you can slowly return to sport, which remember we don't think is a thing. You know, we're either playing sports or we're not. But the idea is that just because pain is gone doesn't mean the problem is gone. So Functional Movement Systems does a good job with this, talking about this pain, injury, motor control cycle. Doesn't matter where you enter in the cycle, all three of these things can happen. So if you have pain, it's going to change the way you move. This is motor control here, which can lead to injury. Or you could get injured, which is obviously going to create pain and change the way you move. Or you could have just a decrease in motor control, like maybe you slept in a bed that wasn't yours, or you slept really poorly, or you traveled on a bus for 10 hours to your sporting event, and now your motor control has changed. This can lead to pain. It can also lead to injury, and both of those are going to lead to each other. So this idea that once your pain is gone, it's okay to return to activity is really dangerous because we're leaving lots of things unresolved under the surface that are what are causing the problem in the first place. So when we're talking about home treatment, we need a more active recovery. That looks like moving the limb in a way that is pain-free, but is kind of stressing the tissue a little bit. We don't need to do ice. There are plenty of other things you can do for pain. Movement helps with pain. I do want to give a shout out to Dr. Eddie Joe. He created a good infographic that Excellence in Motion Rehab posted, and that's where I found it. And it's this idea that movement is medicine and motion is lotion. This infographic particularly deals with diabetics, and that movement creates the same response in the body that metformin creates when you take that prescribed medication for diabetes. And that's not to say that this is exactly what we're talking about, but the idea is that movement creates a physiologic response in the body. And so movement truly is medicine, and we've got to get away from these passive things. We've got to get away from the idea that we can just take things and cover up our pain and then everything's going to go away. And we've got to dive into a better active rehab strategy that helps us heal and return our tissues to the highest quality post-injury, but that we also have to be dealing with what's going on at the surface, because remember, your normal, whatever that is for you, wasn't adequate enough. That's why you got injured in the first place. So we got to make a better you. We got to get you out of pain. We got to solve some of the underlying things that are what got you injured in the first place and rebuild you in a way where when you return to sport, it is exactly that. You can return and play and dominate with no risk or fear of being re-injured or having that same injury come back. So stay tuned. We're going to talk about treatment options and what prevention should really look like. We'll see you next time.